Hello, it's your Potsy Purple Zebra, and today we're going to be talking about quality of life and life expectancy with Chiari malformation. Now, I do want you to think for yourself whether or not you're ready to have this conversation, because it's not for everyone. Not everyone is in a place mental health wise to talk about quality of life or life expectancy. And that being said, I do think it's an important conversation to have because our quality of life and our life expectancy, it's something when we're facing these things every day, we really need support to get through, whether you have Chiari malformation or whether you're watching for a friend or a family member. We all need each other through this process, and we need to feel heard, and we need to process these things in our own way. So I think it's such an important conversation for us to be having as a community. Now, that being said, Chiari malformation quality of life and life expectancy can vary greatly from patient to patient. And so we'll talk a little bit about the different circumstances with your Chiari malformation that can affect those things. For one thing, with Chiari malformation, so much of your quality of life is determined by the position of your Chiari malformation, both the position and the size of your herniation, whether or not it compresses the spinal cord, and also whether or not it's blocking the flow of CSF from your brain to your spinal cord. So all of those things can have a big impact on the symptoms you experience, the quality of life that you experience, and also how it affects your life. Now, if you do have a blockage of CSF, typically patients would have a decompression surgery at that point. Now, decompression is a removal of a small portion of the skull, and sometimes a small portion of the top vertebrae. And what it is, it's to make more room for the brain. So it's especially helpful if your spinal cord is being compressed or if there's a blockage of CSF flow. Now, it's important to know that not everyone has to have a decompression surgery. With any surgery, there's always a risk. There's risk of infection in the brain, there's risk of death, there's risk of paralysis. And so these are all things you need to consider before having surgery, as well as whether or not you have any comorbidities, which we'll get into in a minute. So with surgery, like I said, there's great risks, and these affect your quality of life. They affect your life expectancy. And some patients end up having upwards of 30 surgeries in their lifetime for their Chiari malformation. And in some instances, surgery can bring you great relief, but also it can make things worse if the proper testing wasn't done beforehand, before getting your surgery. So it's so important not to rush into these things and to make sure you're advocating for yourself. Do your research, get the proper testing for comorbidities. So that brings us into another important quality of life factor, is comorbidities. So a comorbidity is just the medical term for diseases that are friends. Where you find one, you usually find the other. So if you do have a Chiari malformation, there are other diseases that you need to be screened for and tested for, which we won't get into all of them, but I'll just name a few. Such as Ehlers-Danlos syndrome is a comorbidity, as well as POTS syndrome, and also hydrocephalus, or what's called water on the brain. All of these things really affect your quality of life as well as your life expectancy. It's important to be evaluated if you have these conditions, to get a proper diagnosis and to get the proper treatment for them. I also want to bring out how Chiari malformation has many, many symptoms, and it can be so debilitating. It can really affect your quality of life and life expectancy. I'm not going to get into these symptoms because there's literally hundreds. When I went to see a Chiari specialist, literally, it was 3 pages of symptoms, like 3 columns wide, top to bottom, 3 whole pages. And when I tell you I had all of them except I think like 3. And the biggest, I think we see across the board, what patients are complaining about, what I see patients complaining about in the Chiari community, is the pain in the base of the skull. And this pain being 24/7 all day, every day. And also, there's times it's definitely worse, but it never goes away. That can be so debilitating, to be in pain 24/7 and to never have relief. And unfortunately, we have lost many in the community because they couldn't take the pain anymore. And unfortunately, they did take their lives because they could not cope with the symptoms and with the pain that they were experiencing. And lastly, I want to talk about sudden death. Sudden death is associated with Chiari malformation. Now, I have seen this featured in some autopsy shows as a cause for death, sudden death associated with Chiari malformation. But also, you can see it featured on the Conquer Chiari website. They talk briefly about sudden death. Now, unfortunately, there are no statistics for us. We don't know at what rate this happens. Nobody can say this is how long you have to live. Nobody can say this is the percentage of a chance of this happening to you. So those numbers are unknown only because they haven't done the studies. But we do know that sudden death is associated with Chiari malformation, and it does happen. We just don't know at what percentage, at what rate. It's really unknown, and the studies haven't been done. So sometimes that can be difficult to cope with, knowing that. But I think it's so important that we're talking about it openly and honestly within the community, because there's nothing worse than when you're trying to deal with this on your own. And when it's like the last thing you think about at the end of the day because you feel like you have no outlet to discuss it. And I know for myself within the Chiari community, it's kind of been like a taboo subject. And there's even been times I've been discouraged from posting about it. And I felt like I had no outlet. You know, if I can't talk to my community about it, who am I supposed to talk to about it? So I think it's so important we're talking about this openly and honestly and supporting each other through it. And I hope I'm giving you permission today to talk about this openly and honestly, and to have these discussions with your friends, with your families, and with your doctor, because we really need each other and we need that support. And another thing that can really help us, if you need the extra support, is seeking therapy and counseling, because it is a lot to deal with when you're enduring all these symptoms and when your life is at risk. You really need that support. So I hope you found this video educational, but also I hope that you found that you have permission to talk about these things openly and honestly. And I hope it's been supportive to you in some way. So thank you for watching, and have a wonderful day.